Every single morning across America, seniors with sciatica wake up and immediately make 7 specific mistakes. Mistakes that happen before they even reach the breakfast table, that directly compress the sciatic nerve, spike the inflammatory environment around it, and set the pain tone for the entire rest of the day. Not big dramatic mistakes, small, habitual ones, the kind that feel completely normal because you have been doing them every morning for years. The kind that nobody ever points out because they look like just getting up and starting your day. Tonight I am pointing them out. All 7. In the exact order they happen every morning. Because fixing these 7 mistakes, one by one, before breakfast every day is the single most high-leverage thing a sciatica patient can do to change how their days feel. And it costs nothing, requires no equipment, and starts tomorrow morning. And real quick, right now, drop a comment below and tell me 3 things. Your age, your city, and how many months you have been dealing with sciatica. I read every single comment personally. And I want to know exactly where this community is in their journey. Age, city, how long. Drop it now, and if you are not subscribed yet, hit that subscribe button immediately. This channel delivers this level of practical information every single week. Now let us get into all 7. My name is Dr. Michael Kent, 20 years of working with senior patients with sciatica. And in those 20 years, the conversation I have had more times than almost any other is this one. A patient comes in frustrated. Their pain is managed. Not great, not terrible, just managed. And they cannot understand why, despite doing all the right things, their mornings always start with pain. Always. Without exception. The answer is almost always the same. What you do in the first 30 minutes after waking up determines the pain tone for your entire day. And most sciatica patients are doing 7 specific things in those 30 minutes that guarantee their day starts badly. Here they are, all 7, starting from the moment the alarm goes off. Mistake 1. You check your phone before you move. The alarm goes off. And the first thing most seniors do before stretching, before sitting up, before anything, is reach for their phone. They check messages, they scroll, they read. They do this for 5 minutes, sometimes 10, sometimes longer. And the entire time they are doing it, their spine is in the worst possible position, flat on their back or on their side, completely static, in the same compressed position it has been in for the last 7 or 8 hours. Here is why this matters so much for sciatica specifically. During sleep, your intervertebral discs absorb fluid. They expand slightly as the compressive load of your body weight is removed. This overnight expansion is a good thing. It means the discs are slightly more cushioned and the spaces around the nerve roots are slightly wider when you wake up than they will be at any other point in the day. But this temporary advantage disappears quickly the moment you start moving with poor mechanics. And lying completely still for an extra 10 minutes while scrolling your phone means the muscles and connective tissue that should be gently warming up and preparing for movement stay cold, stiff, and unprepared, making the eventual transition to standing significantly more abrupt and significantly more stressful on the sciatic nerve. The fix: when your alarm goes off, put the phone down immediately before you check anything. Begin the pre-movement preparation that the next 6 mistakes will describe. Mistake 2. You sit up the wrong way. Most people sit up from lying down the same way every morning. They contract their abdominal muscles, pull their upper body upward, and swing their legs off the bed in one combined motion. This feels normal. It is not the right movement for a sciatica patient. This sit-up motion, contracting the abdominals while the spine is still flat, dramatically increases the pressure inside the intervertebral discs in the lower lumbar spine. Research published in the journal Spine found that disc pressure during the flexion-based sit-up from lying was significantly higher than during a log roll-based transition. For a disc that is already herniated or degenerated, and for nerve roots that are already sensitized from overnight accumulation of inflammatory fluid, this pressure spike is exactly the wrong mechanical event to begin the day with. The correct way to get out of bed for sciatica patients is the log roll technique. Roll your entire body as one unit onto your side, keeping your spine neutral and not twisting. Use your top arm to push yourself up as your legs swing off the bed together. Your abdominals stay relaxed, your spine stays in neutral. The disc pressure stays low. The nerve roots are not suddenly compressed by a flexion pressure spike before you are even standing. This technique takes no longer than the sit-up. It simply uses a different movement pattern. Practice it tomorrow morning and every morning after. Mistake 3. You stand up too fast. You have rolled to your side and pushed yourself up. Now you are sitting on the edge of the bed, and most seniors stand up immediately. They push off the mattress and go straight to standing. This is the third morning mistake for sciatica patients, and it is one of the most consistently damaging. When you sit on the edge of the bed immediately after waking, your lumbar spine is flexed, rounded forward, and the sciatic nerve roots are under tension from the night's accumulation of neural sensitivity. Standing up immediately from this position, going from sitting flexion to full upright in one fast movement, creates a rapid mechanical loading event on the lumbar discs and nerve roots that the nerve is not yet prepared for. The result is the sharp spike of morning sciatica pain that many seniors experience the moment they first stand up, a spike that colors the rest of their morning. The fix is 30 seconds. After sitting on the edge of the bed, sit there for 30 seconds before standing, hands on knees, back gently upright. Take 3 slow, deep breaths. This 30-second pause allows the sciatic nerve to begin adjusting from its overnight horizontal position to the upright position, reducing the tension spike that immediate standing creates. It also allows blood pressure to adjust, which has the additional benefit of reducing morning lightheadedness that affects many seniors. Mistake 4. Your first steps are too fast. You are standing. And most seniors immediately walk at their normal pace, straight to the bathroom, straight to the kitchen, straight into their morning routine. This is the fourth mistake. The sciatic nerve, like every peripheral nerve in the body, requires a gradual mechanical loading transition after overnight recumbency. The nerve has spent 7 to 8 hours in a horizontal unloaded state. The muscles surrounding the nerve in the piriformis, the gluteus medius, the paraspinal muscles have been in a state of minimal activation. The facet joints of the lumbar spine have been decompressed overnight. None of these structures are ready for normal walking pace mechanical loading without a transition period. Walking too fast immediately after standing creates heel strike impact forces that travel up through the lumbar spine before the spinal muscles have activated adequately to absorb and distribute them. Research published in the journal Gait and Posture found that lumbar spine impact forces during walking were significantly higher when walking speed was elevated without adequate warm-up preparation, with the excess forces concentrating at the L4 to L5 and L5 to S1 levels where sciatic nerve roots most commonly originate. The fix. Take your first 30 steps of every morning deliberately slowly, almost exaggeratedly slowly. Shuffle pace if necessary. This is not about staying slow. It is about giving the spinal muscles, the nerve tissue, and the joint structures a 30-step gradual loading transition before normal walking pace begins. Mistake 5. You skip the morning nerve preparation. After your slow first steps, most seniors go straight to the bathroom and then to the kitchen without any specific preparation for the sciatic nerve. This is the fifth mistake, and it is the one that has the most direct impact on how the nerve feels for the rest of the day. The sciatic nerve needs 2 specific things every single morning before the day's mechanical loading begins. First, nerve gliding, a gentle movement that allows the nerve to slide and glide through its surrounding tissue, breaking down any overnight adhesions that have begun forming around the inflamed nerve, restoring the nerve's normal excursion capacity, and reducing the neural tension that overnight recumbency accumulates. Second, piriformis release. The piriformis muscle, which sits directly over the sciatic nerve in the deep gluteal region, tightens during sleep, and its morning tightness is one of the primary mechanical drivers of the first few hours of daily sciatica pain. The morning nerve preparation takes 3 minutes. Perform 10 repetitions of sciatic nerve flossing while sitting on the edge of the bed, simultaneously extending the knee while pulling the toes toward the shin, then reversing. Then perform 1 60-second standing piriformis stretch on each side, crossing the affected leg over the opposite knee and lowering into a slight squat. 3 minutes total. Every morning, Before the day begins, this preparation is the difference between a nerve that starts the day already calmer and a nerve that starts the day already irritated. Mistake 6, your morning drink is wrong, you are in the kitchen now. And most seniors make one of two morning drink choices that are specifically problematic for sciatica. Either they drink coffee immediately on an empty stomach, or they skip hydration entirely and go straight to breakfast. Coffee consumed immediately on an empty stomach stimulates cortisol production. Cortisol is already at its daily peak in the morning. The cortisol awakening response produces a natural surge in the first 30 to 45 minutes after waking. Adding coffee-stimulated cortisol on top of this natural peak pushes cortisol to levels that directly amplify the inflammatory environment around the sciatic nerve. High morning cortisol also increases gut permeability, allowing inflammatory compounds to enter the bloodstream that reach the sciatic nerve tissue and worsen its hypersensitivity during exactly the hours when it is already most vulnerable. The fix is simple. Drink 1 full glass of room temperature water with fresh lemon juice before your morning coffee. This rehydrates the intervertebral discs that have lost fluid overnight, measurably reducing the disc height reduction that increases nerve root compression in the morning hours. It delays the coffee cortisol spike by 15 to 20 minutes, moving it away from the natural cortisol peak period. And the lemon juice provides vitamin C that enhances nitric oxide production in the blood vessels feeding the sciatic nerve, improving intraneural blood flow during the most important period of morning nerve recovery. Mistake 7. You skip breakfast or eat the wrong thing. The seventh and final morning mistake is what most seniors eat or do not eat in the first hour after waking. Two specific patterns are consistently problematic for sciatica patients. The first is skipping breakfast entirely. Overnight fasting has benefits, as this channel has discussed. But extending that fast through the morning without any anti-inflammatory nutritional input means the sciatic nerve spends the entire morning hours without the dietary building blocks for its inflammatory regulation. Specifically, without the protein-derived amino acids needed for nerve tissue maintenance, without the minerals needed for pain receptor stabilization, and without the anti-inflammatory fatty acids needed to counteract the overnight inflammatory accumulation in nerve tissue. The second problematic pattern is a high-sugar breakfast: instant oatmeal with sugar, sweetened cereal, white toast with jam, pastries. High-sugar breakfast triggers a rapid blood sugar spike followed by a compensatory insulin surge. The insulin surge drives an inflammatory response that reaches peak intensity approximately 90 minutes after the high-sugar meal, precisely during the mid-morning hours when most sciatica patients report their pain is at its most demanding. Research published in the journal Nutrients found that high glycemic index breakfast consumption was directly associated with elevated inflammatory markers in adults with chronic musculoskeletal conditions, confirming that breakfast composition directly affects the inflammatory environment that sciatica patients experience through the morning hours. The correct breakfast for sciatica patients contains protein, eggs, Greek yogurt, cottage cheese, smoked salmon, healthy fats, avocado, nuts, olive oil, and fiber from whole food sources, berries, vegetables, whole grain. This combination produces a slow, stable blood sugar rise with minimal insulin response and no inflammatory spike, maintaining a stable anti-inflammatory metabolic environment throughout the morning hours when the sciatic nerve is most vulnerable. Here is your complete 7-point morning protocol starting tomorrow. When the alarm goes off, put the phone down immediately. Log roll out of bed rather than sitting straight up. Sit on the edge of the bed for 30 seconds before standing. Walk at a deliberately slow pace for your first 30 steps. Perform your 3-minute nerve preparation, 10 nerve floss repetitions, and a 60-second piriformis stretch on each side. Drink a full glass of lemon water before your coffee. Eat a protein and healthy fat breakfast without high sugar. 7 changes, 20 minutes total, starting tomorrow morning. In 20 years of practice, the patients who transform their mornings are the patients who transform their sciatica. Because your mornings set the inflammatory and mechanical tone for your entire day. Get the morning right, and every hour that follows is easier. Get it wrong, the way most seniors currently get it wrong, and every supplement, every stretch, and every treatment you do during the day is working against a tide that your morning habits created. Now, before you go, drop your comment right now: age, city, How many months? And tell me, which of these 7 mistakes are you making every morning right now? I read every single comment personally, and your answer helps this channel serve you better every single week. Share this video with someone whose sciatica is always worst in the morning. Subscribe and turn on notifications. 7 mistakes, 7 fixes. Tomorrow morning, your sciatica days finally start differently. This video is for educational purposes only and is not medical advice. All information reflects general educational content for seniors managing sciatica. Individual results vary. Always consult your qualified healthcare provider before beginning any new exercise or dietary protocol, especially if managing serious health conditions or recent spinal surgery. If any movement produces sharp or worsening pain, stop immediately and seek medical evaluation. Dr. Michael Kent is a senior health educator with 20 years of experience in senior wellness. Nothing here is intended to diagnose, treat, cure, or prevent any condition. Viewer discretion advised.